Every 36 seconds, someone dies from heart disease. But here's what doctors don't tell you. Your heart sends 5 clear warning signals months before a heart attack strikes. Most people ignore them. Today, you'll learn exactly what to look for so you don't become another statistic. Heart disease remains the leading cause of death for adults over 60, but here's what most people don't realize. Your heart sends clear warning signals months or even years before a major cardiac event. The problem is that many seniors dismiss these signs as normal aging or minor inconveniences. Research from the American Heart Association shows that recognizing and acting on early warning signs can prevent up to 80% of serious cardiac events. Your heart doesn't suddenly fail without warning. It communicates distress through specific symptoms that, when recognized early, give you time to seek treatment and prevent heart attacks, heart failure, or sudden cardiac death. The key is knowing what to look for and taking action promptly. Before we dive in, where are you watching this from, and what's your age? Drop it in the comments below. Now, let me reveal the 5 early warning signs of heart problems, starting with number 5. Warning sign number 5. If you find yourself feeling unusually tired or exhausted during activities that never bothered you before, your heart might be struggling. This isn't the normal tiredness from a busy day or poor sleep. This is profound fatigue that doesn't improve with rest, makes simple tasks feel overwhelming, and seems disproportionate to your activity level. You might feel drained after climbing a single flight of stairs, need to rest frequently during routine activities, or feel too tired to do things you normally enjoy. When your heart isn't pumping blood efficiently, your muscles and organs don't receive adequate oxygen and nutrients. Your body responds by making you feel tired, forcing you to slow down and reduce the demands on your struggling heart. Fatigue is often one of the earliest signs because your heart can compensate for minor problems by working harder, but this extra effort leaves you feeling exhausted. Women, in particular, often experience fatigue as their primary heart problem symptom, sometimes weeks or months before any other signs appear. A comprehensive 2024 study published in the Journal of the American College of Cardiology followed 5,000 seniors over 10 years. Researchers found that persistent, unexplained fatigue was present in 71% of participants who later developed significant heart disease, and it appeared an average of 14 months before diagnosis. Another study from Johns Hopkins in 2023 examined women specifically and found that unusual fatigue was the most common early warning sign of heart disease in women over 60, present in 67% of cases, yet it was also the most frequently dismissed symptom. If you experience persistent fatigue lasting more than 2 weeks that doesn't improve with rest or seems excessive for your activity level, schedule an appointment with your doctor this week for cardiac evaluation. Warning sign number 4. Shortness of breath, medically called dyspnea, means feeling like you can't get enough air, or that breathing requires more effort than normal. In the context of heart problems, this often occurs during physical activity that previously didn't cause breathlessness, or it may happen when you're lying flat in bed at night. You might find yourself needing to prop up with extra pillows to breathe comfortably while sleeping, waking up gasping for air, or feeling winded after walking short distances. When your heart's pumping ability weakens, blood can back up into the vessels in your lungs, causing fluid accumulation. This condition, called pulmonary congestion, makes your lungs less efficient at oxygen exchange, resulting in breathlessness. Your heart may be working adequately when you're at rest, but when you exert yourself, even mildly, your weakened heart can't pump enough blood to meet your body's increased oxygen demands. Shortness of breath that occurs when lying down, called orthopnea, is particularly concerning. When you lie flat, fluid redistributes throughout your circulation, including your lungs, and a struggling heart can't handle this extra fluid load. A 2024 study in Circulation examined over 8,000 seniors presenting with new shortness of breath. In 43% of cases, the underlying cause was heart-related, specifically heart failure or coronary artery disease, even when patients had no prior cardiac history. Research from the Mayo Clinic in 2023 specifically examined nighttime breathlessness and found that seniors who needed more than one pillow to sleep comfortably or who woke up short of breath at night had a 3.5 times higher risk of having undiagnosed heart failure compared to those who slept flat without difficulty. If you notice breathlessness during activities that never bothered you before, or if you need to prop yourself up with pillows to sleep comfortably at night, see your doctor promptly for heart function evaluation. Warning sign number 3. Edema or swelling typically appears in your lower legs, ankles, and feet. You might notice that your shoes feel tight by the end of the day, socks leave deep indentations in your skin, or your ankles look puffy. When you press your finger into the swollen area, it may leave a dent that slowly fills back in. This swelling often worsens throughout the day and may improve slightly overnight when you're lying down, only to return the next day. When your heart isn't pumping effectively, blood flow slows down, and blood returning to your heart through your veins can back up. This backup increases pressure in the veins of your legs, pushing fluid from your blood vessels into surrounding tissues, causing swelling. Gravity pulls this fluid downward, which is why it typically accumulates in your feet, ankles, and lower legs first. Your kidneys may also respond to reduced blood flow by retaining salt and water, further contributing to swelling. Sudden or rapidly worsening swelling is particularly concerning, as it suggests your heart's pumping ability has declined significantly. A comprehensive 2024 study in the European Heart Journal tracked 6,200 seniors with new lower extremity swelling. Researchers found that 38% had underlying heart failure as the cause, even though many initially attributed their swelling to hot weather, too much salt, or sitting too long. The study revealed that when swelling was accompanied by even mild breathlessness or fatigue, the likelihood of heart failure jumped to 64%. Research from Cleveland Clinic in 2023 found that lower extremity edema appeared an average of 6 months before patients were diagnosed with heart failure. If you notice new or worsening swelling in your ankles and feet, particularly if it doesn't fully resolve overnight or is accompanied by breathlessness or fatigue, contact your doctor within a few days for evaluation. Warning sign number 2. Heart palpitations feel like your heart is racing, pounding, fluttering, or skipping beats. You might describe it as your heart flip-flopping in your chest, beating too fast or too hard, or feeling like it pauses or skips. These sensations can last seconds or persist for minutes or longer. Some people feel palpitations in their chest, throat, or neck. They may occur during activity, at rest, or even wake you from sleep. Palpitations can signal various cardiac issues, but after 60, they're particularly concerning for atrial fibrillation, an irregular heart rhythm where the upper chambers of your heart beat chaotically instead of in a coordinated pattern. Atrial fibrillation significantly increases your risk of stroke because the irregular beating allows blood to pool and form clots in your heart, which can then travel to your brain. Palpitations can also indicate other arrhythmias, coronary artery disease, causing inadequate blood flow to your heart muscle or heart valve problems. Even if palpitations come and go, they indicate your heart's electrical system isn't functioning properly. A landmark 2024 study in The Lancet followed 12,000 seniors experiencing palpitations. Among those over 60 with new palpitations, 52% were found to have atrial fibrillation, and another 18% had other significant arrhythmias. The study found that seniors who reported palpitations and received prompt cardiac monitoring and treatment had a 40% lower risk of stroke compared to those who delayed seeking medical attention. Research from Stanford University in 2023 discovered that palpitations accompanied by dizziness, lightheadedness, or shortness of breath were particularly concerning, as these combinations indicated the arrhythmia was affecting blood flow to the brain and body. If you experience palpitations, especially if they're new, frequent, or accompanied by dizziness, chest discomfort, or shortness of breath, see your doctor immediately for cardiac rhythm evaluation and monitoring. Warning sign number 1. Chest discomfort related to heart problems typically feels like pressure, squeezing, fullness, tightness, or heaviness in the center or left side of your chest. It's often described as feeling like an elephant sitting on your chest, a tight band around your chest, or uncomfortable pressure that won't go away. This discomfort may come and go, lasting a few minutes then easing, or it may persist. It often worsens with physical activity or emotional stress and improves with rest. Heart-related chest discomfort doesn't always mean sharp stabbing pain. Cardiac chest discomfort is typically more diffuse, affecting a broader area of your chest, and may radiate to your left arm, both arms, your neck, jaw, back, or stomach. Chest discomfort or pressure is your heart's most direct warning that it's not receiving adequate blood flow. When the arteries supplying blood to your heart muscle become narrowed or blocked by plaque buildup, your heart muscle doesn't get enough oxygen, especially during exertion when it needs more. This oxygen shortage, called ischemia, causes chest discomfort. This is the most serious warning sign because it indicates you're at immediate risk for a heart attack if one of those narrowed arteries becomes completely blocked. Chest discomfort that occurs with exertion and goes away with rest is called stable angina. But if chest discomfort begins occurring at rest, lasts longer than usual, or becomes more frequent or intense, this is unstable angina, a medical emergency. A comprehensive 2024 study in the New England Journal of Medicine examined over 15,000 seniors who presented to doctors with chest discomfort. Among those over 60, 68% were diagnosed with significant coronary artery disease, and 23% were found to have severe blockages requiring immediate intervention. The study emphasized that even brief episodes of chest pressure, lasting just 2 to 5 minutes with exertion, indicated significant heart disease requiring treatment. Research from the American Heart Association in 2023 studied seniors who experienced but initially ignored chest discomfort. Those who delayed seeking care by more than 1 month had 3 times higher rates of heart attack and death compared to those who sought evaluation within 1 week of first experiencing symptoms. If you experience any chest discomfort or pressure lasting more than a few minutes, or if it occurs at rest or is accompanied by shortness of breath, nausea, or sweating, call emergency services immediately, as you may be having a heart attack. While each of these warning signs is concerning on its own, experiencing multiple signs together is particularly alarming and demands immediate medical attention. If you have persistent fatigue along with swelling in your legs or breathlessness combined with palpitations, your heart is struggling significantly. A 2024 study from Johns Hopkins found that seniors experiencing 2 or more of these warning signs simultaneously had an 85% likelihood of significant heart disease requiring treatment. The more warning signs you experience, the more urgent your need for cardiac evaluation. Don't wait for symptoms to become severe or for all 5 signs to appear. Even 1 persistent warning sign warrants medical evaluation. Your heart communicates clearly when it's in trouble. Persistent fatigue, breathlessness, swelling, palpitations, and chest discomfort are not normal parts of aging. They're warning signs that your heart needs help. Recognizing these signs early and seeking prompt medical care can prevent serious cardiac events and save your life. If you're experiencing any of these warning signs, don't wait. Call your doctor this week. Share this video with family and friends, especially those over 60. Early recognition and action make all the difference.